He still gets up, still goes to work, still handles what needs to get done. But something has changed. His sex drive is lower. His energy is gone by late afternoon. His waist is growing. His workouts feel less effective. He feels foggy, flat, less like himself. And because it happened slowly, he tells himself what a lot of men tell themselves. It's just stress. It's just age. I probably just need better sleep. Sometimes that's true. But sometimes those quiet changes are not random. They are part of a pattern. And that is exactly why low testosterone gets missed for so long. It usually does not arrive like a fire alarm. It shows up like dimming lights, one bulb at a time. In this video, we're going to walk through the signs men often ignore, which symptoms doctors take most seriously, which symptoms are much less specific, how low testosterone is actually diagnosed, and what to do next if this sounds familiar. The reason this gets confusing is simple. Low testosterone symptoms overlap with regular life. Poor sleep can drain your energy. Stress can lower your sex drive. Depression can flatten your motivation. Weight gain can change your body and your confidence. Burnout can make everything feel harder. So a man can spend months thinking he has 5 different problems, when the real question is whether those problems are connected. That does not mean every tired man has low testosterone. It means one symptom by itself rarely tells you much. That is why good doctors do not diagnose testosterone deficiency from a symptom list alone, and they do not diagnose it from one random blood draw either. Major guidance says the diagnosis should be made only when symptoms or signs fit, and testosterone is clearly low on reliable testing. So let's start with the symptoms that carry the most weight. One of the strongest clues is a drop in sex drive that lasts. Not one stressful week, not one rough month, not one temporary dip because life got chaotic. A real change from your normal that sticks around. Reduced sexual desire is one of the most consistent symptoms associated with testosterone deficiency, and expert guidance treats sexual symptoms as some of the most useful clues during evaluation. A lot of men do not lead with this. They talk about being tired, distracted, irritable. But sexual symptoms are often the part of the story that helps the most. So if your interest in sex has dropped and it keeps feeling out of character, do not brush that off too fast. And the next sign matters for a similar reason. Morning erections are easy to ignore, but they can be a very useful signal. Why? Because erections during sex can be affected by anxiety, alcohol, relationship stress, fatigue, or performance pressure. Morning erections tell a slightly different story. If they become less frequent or less firm over time, especially along with lower sex drive, that pattern becomes more meaningful. Expert recommendations specifically treat low desire, fewer spontaneous or morning erections, and erectile changes as an important symptom cluster. This is not about obsessing over one morning. It is about noticing a change in your usual pattern. This is where many men jump too fast. Yes, erection problems can happen with low testosterone, but they can also come from blood vessel disease, diabetes, smoking, anxiety, poor sleep, depression, or medication side effects. That is why erectile changes matter most when they show up alongside lower sex drive or fewer morning erections, not as a standalone guess. So if erections are weaker than usual or something has changed, take it seriously. Just do not self-diagnose from that one symptom. Now we move into the symptoms that are real, but much easier to misread. A lot of men start here. I'm exhausted all the time. I hit a wall every afternoon. I wake up tired. I don't have the same drive. Fatigue can happen with low testosterone. But by itself, it is a weak signal. Sleep apnea can do this. Burnout can do this. Depression can do this. Anemia can do this. Thyroid problems can do this. Some medications can do this. That is why fatigue becomes more meaningful when it travels with the sexual symptoms we already covered, not when it appears alone. Some men never say, "I think my testosterone is low." They say, "I just don't feel like myself." They feel mentally slower, less focused, less motivated, more irritable, more flat. These symptoms can happen with testosterone deficiency, but they also happen with poor sleep, chronic stress, anxiety, depression, and other health problems. They tell you something may be off. They do not tell you what the cause is. So treat these symptoms like a flag, not a conclusion. Maybe you are still working out, but the results do not look the same. You recover slower. You lose strength faster. You feel softer. You do the same work and get less back. Testosterone helps support muscle mass, strength, and physical function, so loss of muscle or a weaker response to training can be part of the picture. But it also overlaps with aging, lower activity, poor recovery, pain, and low protein intake. This becomes a stronger clue when it shows up with lower libido, more body fat, or persistent fatigue. This is where a lot of men feel frustrated. The waist keeps growing, the body feels softer, the mirror looks different, and the first thought is usually age. But the relationship between body fat and testosterone goes both ways. Low testosterone can contribute to less favorable body composition, and excess body fat can lower testosterone. That means for some men, this becomes a loop. More body fat, lower testosterone, lower energy, harder workouts, more body fat. Obesity and metabolic disease are common contexts where clinicians think more carefully about testosterone deficiency, especially when symptoms are also present. And there are a few less common changes that matter too. These are not the signs people talk about first, but they matter. Smaller testicles, less body hair, breast enlargement or tenderness, fertility problems, bone loss that may raise fracture risk. These signs are less common than fatigue or lower libido, but they can be more specific and deserve real medical attention. Testosterone plays a role in sexual function, fertility, and bone health, not just energy or gym performance. Here is the simplest way to think about it. One vague symptom usually does not tell you much. A cluster of symptoms tells you more. This deserves a real conversation when low sex drive lasts for weeks or months, morning erections become less frequent. Erections are weaker than usual, fatigue shows up along with sexual symptoms. Muscle seems to drop while body fat goes up, or you have obesity, diabetes, infertility, sleep apnea, or a history of pituitary or testicular problems. That is when it makes sense to stop guessing and start tracking. Those risk contexts are consistent with how guidelines frame evaluation and when clinicians should think more carefully about testosterone deficiency. This may be the most important part of the whole video. Low testosterone is not diagnosed from symptoms alone. It is not diagnosed from a social media checklist, and it should not be diagnosed from one random borderline test. Doctors usually diagnose testosterone deficiency when two things line up. First, symptoms or signs fit the condition. Second, testing shows testosterone is consistently low. Timing matters too. Guidelines recommend measuring testosterone in the morning, and if the first value is low, repeating testing on another morning helps confirm that the result is real. Depending on the case, doctors may also check other hormones to help locate the cause. That careful approach helps prevent two mistakes: missing a real problem or blaming testosterone when something else is actually driving the symptoms. One clue is not enough. One number is not enough. The pattern and the testing have to line up. The internet loves simple answers. Tired? Low testosterone. Gained weight? Low testosterone. Feeling off? Low testosterone. But real medicine is not that simple. Poor sleep can affect energy and hormone levels. Obesity can affect testosterone. Depression can look similar. Thyroid problems can overlap. Diabetes can overlap. Medication side effects can blur the picture. So when men self-diagnose too fast, they can miss the real cause. And sometimes the real cause needs attention just as much as the hormone number does. Guidance from specialist groups stresses evaluation, confirmation, and proper workup rather than symptom-only assumptions. This is the part many videos skip. Testosterone is not a casual fix for feeling tired, frustrated, or older. One big reason is fertility. Major guidance warns that exogenous testosterone can suppress sperm production, which is why men who are trying to conceive should not self-start it. There are other reasons to be careful too. Some men need monitoring for blood count changes. Some need evaluation for sleep apnea. Some need prostate-related follow-up. Some need other causes ruled out first. That does not mean testosterone therapy is always wrong. It means it should be individualized, monitored, and used for confirmed deficiency, not vague symptoms alone. If several of these signs sound familiar, here is the smart next step. First, notice the pattern. Not one symptom, the pattern. Second, write it down. Lower sex drive, fewer morning erections, erection changes fatigue, lower motivation body changes, loss of strength mood or focus changes. Third, think about timing. When did this start? Did it come on slowly? Did your sleep change? Did your weight change? Did stress spike? Did you start a new medication? Fourth, bring up sexual symptoms directly, even if it feels awkward. And fifth, ask your doctor whether morning testosterone testing makes sense in your case. That is the smart move, not panic, not guesswork, not supplement roulette. Just a better conversation with better information. Let's bring it together. Low testosterone is easy to miss because the symptoms develop slowly and overlap with everyday problems. The strongest clues are usually sexual symptoms: lower sex drive, fewer morning erections, and erection changes. Other signs can matter too: fatigue, brain fog, low motivation, more body fat, and less muscle. But those are less specific. That is why diagnosis needs more than a symptom list. It needs proper testing, usually with morning blood work that is repeated if the first result is low. That approach is consistent with specialist guidance from the Endocrine Society and AUA. And testosterone treatment should not be started on your own, especially if fertility matters or another untreated condition could be the real cause. Save this. Then, do one thing today. Write down the symptoms you've been ignoring and bring that list to your next appointment. That one step can turn a vague worry into a much more useful doctor visit. And if you want the next video, watch this one. What your doctor should rule out before blaming everything on low testosterone. Because one lab number never tells the whole story. This content is for educational purposes only and is not intended as medical advice, diagnosis, or treatment. Always consult your doctor or a qualified healthcare provider before making any changes to your health routine.